I just want to do a quick message, y'all, because this is my face when I have had another out-of-state patient come in and spend nearly 2 full days with me and learn how to not just adore her pelvic floor, but to come through like the fire of endometriosis and medical gaslighting and arrive on the other side after we've done this intensive care and then finally say, I finally have answers, right? She's been to Dr. Vidali. Shout out to you, Dr. Andrea Vidali, for your excellent work in excision surgery. And now she's on the other side of that. And then we're handling everything else. So I can't even list it all because we did 2 full days, nearly 2 full days of work. But the point is, I am overjoyed to be able to be in this position, a privilege to be able to help women through their endometriosis journeys, of using the voice to pelvic floor approach, of using ultrasound imaging, of being able to not guess, of having the privilege of not guessing because of imaging, of having the privilege of 30 years of experience so that I can fully and thoroughly evaluate everything from a pelvic health perspective and everything from an orthopedic perspective. And for those of you who aren't familiar with the approach that I take to helping women with endometriosis, it is a very holistic, functional medicine approach using integrative and lifestyle medicine as the intervention, as well as a voice to pelvic floor approach in pelvic and ortho PT. So we're considering things like the gut microbiome, the vaginal microbiome, the estrogen microbiome, so the estrobolome, estrogen plus gut microbiome. We are considering inflammation. We are considering, and that's at a systemic level, not just local. We are considering nutritional triggers that might, be rearing their ugly heads, like histamine intolerance, that kind of thing. We are considering all of the scar work that needs to be done. We are considering motor patterning. There are so many things that need to be done, not just the things that you would think about from a systemic standpoint. If you're wondering how I manage endometriosis, then please go and visit my YouTube channel. There's a video on the holistic way that I approach it as a pelvic ortho practitioner, but also someone who is board certified in lifestyle medicine and a bunch of other stuff. The point is, it's a privilege to be able to take care of women in this space. So if you're struggling with endometriosis, and especially if you've had excision, if you haven't had excision, please reach out, because I want to help you point you in the right direction to an excellent excision surgeon. There are many of them, because ablation is not the answer and it's not the gold standard. Excision is, and skilled excision is. And then after that, excision is step 1. Step 2 is all the post-op rehab that happens, because the pain doesn't magically go away. So if you're experiencing that level of pain still, which is going to happen, know that it's normal. Some women will say, my pain immediately went away after surgery, but then it started to creep back. Has my endo come back? Not necessarily. Not necessarily. It's that you had surgery, which is its own special list of deficits that's created. You have new scars. Those have to be taken care of. How did your pelvic floor and your core react? How did your hip and pelvic girdle react? Just to the incisions alone, not to mention all of the vast work that has to be done internally to get rid of those lesions and adhesions, you end up with a lot of post-op issues that they're not abnormal. It's what happens to everyone, and those have to be worked through. So if someone's telling you, you've had excision, your pain should be gone, not true. The original pain that the lesions would cause is gone and that is true. But all of the other deficits that come as a result of surgery, like, for example, I was imaging someone with endometriosis today, post-op excision, having been to Dr. Vidali, like I mentioned, and you could see in real time in imaging and using this voice to pelvic floor approach that the pelvic floor was completely uncertain of what it was supposed to do. It was like little tremors of activity. It was tight, and then it was doing the opposite thing that would be asked to do. Then I would have the pelvic floor do a different task, or the core to do a different task, and it would be okay. And then the next time we would ask it, I would ask it to do something specific, it would be off again. And I say it because it's not your fault. if your pelvic floor doesn't spring back after surgery. It is not your fault when the core completely shuts down and shuts off, and then you just have this global pelvic girdle and back pain. That's not your fault. You didn't do anything wrong. It's normal. It's a part of the post-op process. And that's why excision is step 1, and really good post-op pelvic and ortho rehab is step 2. Now, if you cannot find someone who can do both pelvic and ortho and imaging and functional integrative lifestyle medicine, contact me. I do take a limited number of out-of-state, out-of-country patients. I will help you as much as I can, but I am only one person. I do teach continuing education, so I am actively engaged in teaching other practitioners how to do this, but I'm only one person. So I will try to point you towards practitioners that can help you in your area, other pelvic and ortho practitioners that I know. But I think ideally that they need to be taking a 5-pronged approach: pelvic and ortho, immune, gut microbiome, the estrobolome, which goes along with that, and inflammation at a bare minimum. And they should have a giant endo toolbox of how to do that. If you are a practitioner that doesn't have that in your toolbox, then I want you to do something for me. Don't pretend like you're treating endometriosis. Don't pretend like you're managing it as a pelvic health practitioner or as an ortho practitioner, because you're not. I'm getting patient after patient coming to me who has really been gaslit or let down by their pelvic PT or OT practitioner because they don't specialize in pelvic health or ortho. And just because you're a pelvic PT, or just because someone is a pelvic PT, doesn't mean they specialize in endo. It is really a whole other category of treatment. So if you have failed pelvic PT before, then it just may be that they don't specialize in endo. So if you haven't had any specialized training for endometriosis, then don't claim that you're treating endometriosis, okay, or helping manage endometriosis as a pelvic PT. It's not doing the rest of us any favors because they think they'll have tried pelvic PT or OT and failed, when it's just that the practitioner wasn't skilled or schooled in all of these specialties. And let them know your limitations if you're a pelvic PT or OT and you don't specialize. Say, hey, look, I'm a pelvic PT, but I don't specialize in endo, but I know someone who does. I'm happy to consult with anyone who has questions anywhere about how to go about helping, patients in the best way possible. And from the patient side, again, just because you've tried pelvic PT or OT does not mean it doesn't work. Again, they need to take a 5-pronged approach. And I strongly believe that they need to use a voice to pelvic floor approach and methodology, which is a course that I do teach. I'm not here to sell anything. I am here to help people and women, specifically with endo. And if that means I am teaching continuing education, if that means I am seeing patients, which I do both for that reason, which is, frankly, I don't have enough time in the day to do all of that stuff. It's because I'm passionate about helping women with endometriosis. Because if I wanted to make a bunch of money, I wouldn't be doing this. I would not be in this profession. This is not how you make a boatload of money. This is how you help change the future of endometriosis care worldwide. And I'm in the US, so particularly, in the United States, but definitely worldwide. So if you have questions in your practitioner, don't be shy, reach out. I'm here to help. If you're not getting the care that you need, it does not mean that your therapy failed. It just means there may be pieces missing, right? When I use imaging, for example, it takes the guesswork out of it. I know exactly how to drill down and look at the problem. It does not mean that I'm not going to have someone come in that is have been what we call centrally sensitized and they have a pain management issue that they're looking at. But I think the biggest mistake that is made in looking at an endo patient is saying, oh, we're just going to give you muscle relaxers or painkillers, or you just need to relax more, or you had surgery, it should be better, shouldn't it? None of those things are going to be effective or they're going to be helpful. So if you're getting those things, the pain is all in your head, just take a muscle relaxer. That's doing absolutely nothing for the fascia, for example, around the scarring and the deep scarring and adhesions that endo bodies love to lay down. It's not doing a thing for systemic inflammation. It's not doing a thing for identifying nutritional triggers. All right, so I originally intended on this video being like 2 minutes, maybe a minute long. but it's hard to stop talking about endometriosis when I see so many missing pieces out there that are happening inside the profession of pelvic PT and pelvic health and pelvic OT. Also, if you're a patient, one more thing. Excision is step one. If you have prehab and you set yourself up in the post-op for pelvic, and I'm going to stick to PT right now because pelvic PTs are honestly going to be better suited because then they need ortho and pelvic experience, and OT isn't necessarily going to have that. Some may, and that's great. But I can only speak to my profession right now. Pelvic PT and OT is essential. Some training in integrative lifestyle and functional medicine is essential. Training in dry needling and training in ultrasound imaging, I believe, is essential in order to go the whole distance and to get someone entirely better where they can manage that endometriosis from where they sit. That's the job, is to empower someone where they don't need me anymore, where they don't need another pelvic PT provider anymore. All right, so I hope this has been helpful. If it has, share this with someone who has endo. There is hope. You need a comprehensive approach. Sometimes, many times, we need multiple team providers beyond the surgeon and the pelvic PT or OT. We need other providers. Maybe it is mental health. Maybe it's processing some trauma around medical gaslighting or other trauma, or trauma, surgical trauma, where it wasn't taken care of appropriately and now you've ended up with more problems. It could mean a nutritional adjunct, someone who's in the nutrition profession. It could mean a functional med MD or DO who can help manage the hormone aspect of this, because it must be managed. There's a great deal that I can do from my seat, but I cannot do it all. But that's how I help women manage their endometriosis pain. I am over the moon to have helped another one from a person from Ohio today, and safe travels to her as she goes back and then looks to her next visit in the future. If you are interested in doing long distance care, concierge care, I call it intensive care or PT too. I do take patients from out of state. I do take patients from out of country. We do have to plan a good amount of time out, but my first consult is free. I will look at your records. I will give you an honest assessment and tell you whether or not I believe that I can help. And if there are practitioners in your state that I am aware of, I will help connect you to them. And I can often send you back with very specific directives and points of action where you can get help from local providers as well. Because it takes a village to be well when you're trying to manage endometriosis. All right. Links are going to be in the description for getting in touch if you would like a free consult. If you just want some direction or support, or just reach out with questions, put them in the comments below. Thank you.